So good, excellent. So good afternoon, everyone, or good day, depending on where in the world you are joining this webinar from. And a very good afternoon to distinguished guests, colleagues, healthcare professionals, policymakers, regulators, and development partners. So on behalf of the Healthcare Federation of Nigeria, and in collaboration with the Nigerian Center for Disease Control, the Pharmacy Council of Nigeria, PharmAccess, and Society for Family Health, I'd like to warmly welcome you to today's webinar on Ebola preparedness and healthcare facility readiness. Now, just a quick intro is that the recent history we've had of Ebola outbreaks across Africa reminds us that infectious disease threats remain a constant challenge to health systems. And while outbreaks may begin in one single location, as we're seeing with the current Ebola outbreak, we need to remember that it can rapidly escalate into national, regional, and even global public health emergencies. Nigeria's successful containment of Ebola in 2014, and so excited to have the Director General of the Nigeria Center for Disease Control here because it was one of the heroes of that. It remains one of our most cited examples of an effective outbreak response. Well, preparedness is not a one-time achievement. It requires continuous vigilance, strong surveillance systems, resilient healthcare facilities, trained personnel, effective governance, and collaborations between the public and the private sector. And so today's webinar brings together distinguished leaders who have been in the forefront of outbreak preparedness, health regulation, healthcare quality improvement, and global health system strengthening. And so at this webinar, we're going to explore the current landscape of Ebola preparedness in Nigeria, healthcare facility readiness and resilience, the role of regulations and professional standards, lessons from previous outbreaks, and the introduction of an interesting initiative, the SafeCare4Outbreaks, and then practical actions that you as a healthcare facility owner can take today. So thank you very much for joining us on this webinar. And my name is Dr. Jennifer Nyanti, and I'm the second Vice President of the Healthcare Federation of Nigeria, and I'm also the Managing Director of SFH Advisory and Professional Services. I'd like to, of course, start before I introduce my speakers with welcome remarks from the President of the Healthcare Federation of Nigeria and the Country Director of PharmAccess Nigeria. This is Njide Ndili. So over to you, Ma, for your opening remarks and comments. Thank you.
Okay, thank you very much, Jennifer, for your introduction. Again, I want to say welcome to everybody who has joined the webinar. Special thank you to Dr. Idris. I didn't let him breathe over the weekend because I was trying to ensure that himself and his team had an insight into this webinar and the tool that we're trying to present. I have an interesting role being both the president of the Healthcare Federation as well as the country director for PharmAccess, where the team within PharmAccess over the years have proven time and time again that technology is one of the drivers of the health system and creating efficiency in the health system. So we saw this opportunity with the recent outbreak in Congo and East Africa that we can actually strengthen some of the work we do around quality with our SafeCare methodology to kind of translate that over to hospital preparedness. We did something similar during COVID, which was extremely successful. This is not a webinar where we want to preach, but rather to give you just practical tools for the healthcare facilities that would enable them prepare. Once Ebola gets in, it's here already. Then our preparation is not fully in swing. So I think that preparedness is our best defense. Every facility that strengthens its readiness strengthens Nigeria's health security. So not only that, from the community pharmacy and patent medicine vendor perspective, which is also why we have the Pharmacy Council of Nigeria. I think it's also important to have them along, in this discussion so that we can hear from them from the regulatory point of view, but also from the private sector point of view, because as we know, that is going almost certain that will be the first point of contact if it ever shows up on our doorstep, which I hope it doesn't. So I hope we all engage with this discussion. I myself, I'm looking forward to understanding how we ourselves can be prepared as individuals as well. I've had a few people call me and ask whether they should wear a face mask. And I said, no, this is not a respiratory virus. So I look forward to all the information that will be passed on today. Also, thank you to Professor Tobias, who we call a mad scientist within PharmAccess, whose energy and passion is around infectious diseases. So I welcome you all, and I thank you very much. And I hope that with this information, we can better prepare ourselves and our healthcare facilities for any imminent outbreak. Thank you very much, and back to you, Jennifer. Jennifer, can you hear me? Okay, so it looks like we've lost Jennifer. So if she's not available, then I think I'll hand over to PCN pharmacist, and just for a few remarks before we go to Professor Tobias. Over to you if you can hear me.
Okay, thank you so much. All right, you can hear me. Okay, thank you so much. It's a privilege, and we thank you for the opportunity to be part of this webinar, to be part of this conversation. On behalf of the Registrar and CEO of the Pharmacy Council of Nigeria, Pharmacist Ibrahim Babashehu Ahmed, I bring you warm regards from the management, from the Registrar himself and the management of Pharmacy Council of Nigeria. Yes, these conversations are very strategic at this point. Given the role that community pharmacists and the PPMVs play in the community where they serve. We know that usually in the community pharmacists and the PPMVs, that is the patent and proprietary medicine vendors, are usually the port of call. For the urban and semi-urban, the community pharmacies, and then for the rural and of course some of the semi-urban areas, the PPMVs, and they play a very crucial role for the ill in the community. Now, before I go to their roles, the Pharmacy Council is the regulator of these healthcare providers in the community. And so we know that existing disease surveillance architecture in Nigeria do not capture these providers. And as these conversations begin, I think that we believe at the PCN that it will be crucial to have them on board, that is the CPs and the PPMVs. They are strategic. Why do we think it will be good? Because they operate in the community, they observe disease trends in real time, they are able to detect unusual medicine demand patterns, identify clusters of symptomatic patients, provide preliminary public health advice, refer suspected cases promptly, and also support risk communication. We believe that with these advantages, it is very crucial that we have these healthcare providers at the community level to be part of the surveillance architecture in Nigeria. We know that, given their interactions with the community members, it will be key that they are trained, and then the channel for reporting is created. We know as these conversations begin, we are hopeful that these channels where they can report, give information to the surveillance or make information available to the surveillance architecture in Nigeria, it will become very, very germane to protecting the health of the nation. So on behalf of the Council, once again, I wish us very fruitful deliberations on this webinar. Thank you very much. Over.
Thank you very much. And I do apologize, everyone. The usual thing, I don't want to say Nigeria happened to me because it did not, but I fell off the call. So my apologies. I'd like to say a warm thank you to PharmAccess because I see that she has given her remarks just as I was joining back. So thank you very much for your remarks on behalf of the Registrar and Chief Executive Officer of the Pharmacy Council of Nigeria. And as head of the country's pharmacy regulatory body, he plays a critical role in ensuring quality pharmaceutical services, professional standards, and healthcare facility compliance. So thank you very much for representing the registrar here and itemizing the importance, of course, of the pharmacy. We call it the pharmacy primary healthcare sector in Ebola preparedness. So I'd like to now hand over my mic to introduce somebody who has been introduced earlier, and I hope he's already on board. So, Prof. Tobias, I hope we can see you here now. And so joining us all the way from the Netherlands is Professor Tobias Rinke de Wit, I hope I pronounced that well, who is professor at the Amsterdam Institute of Global Health and Development. Professor Wink is an internationally recognized expert for his work in infectious diseases. As a matter of fact, before we had the call, we had already started discussing about some of the recent, the new things that are happening in the space. I'm sure we'll mention it while he's speaking today. And he's internationally recognized for his work in infectious diseases, health system strengthening, and innovative approaches to improving health quality and outbreaks preparedness globally. And so we're really honored to have his participation today. And I hand over to him for the next 10 minutes to discuss. Thank you very much, Prof. And once again, a very Nigerian welcome to you.
Thank you very much, Dr. Jennifer. It's a pleasure to be here. I see that the actual number of participants is at 199, so we're almost at the 200 level, which I'm proud of. Let me share my screen and ask you, can you see my screen? Is everything okay like that?
Yes, we can.
Very good, very good. Okay, well, in the next 10 minutes, let me update you a bit on the current Ebola situation. The Bundibugyo virus, as it's called, that starts basically where and when. Well, we know the outbreak is in the eastern part of DRC, Democratic Republic of Congo, and the extreme western part of Uganda. It was reported May 15, 2026. But when we do back calculations based on sequencing data of the viruses, then the plausible spillover event was around mid to late February 2026. In other words, the virus has remained invisible for a couple of months, and that is quite new for an Ebola outbreak because normally it is seen much earlier. The reason it's seen later is that this is, of course, not the standard Ebola outbreak, but it is a sister virus of Ebola, the Bundibugyo virus. And the testing systems for those viruses are not available, and therefore the virus can move freely and without being seen, and therefore spread amongst populations. So that was one of the reasons also that this epidemic is creating great concern, because it has been hiding away for a couple of months now, and we don't know to what extent it has been spreading. And that also made WHO immediately move forward in this. Now, what is the current situation, let me say, until yesterday, June 7? First of all, in the Democratic Republic of Congo, we see that there are 550 confirmed cases now. The actual numbers were higher a couple of days back, but because new confirmatory tests were introduced in the Congo, we could really check each and every infected individual and see that indeed 550 infections are confirmed. Of course, this is a top of an iceberg that is unknown. There is another 117 suspected cases, And amongst the confirmed cases, 101 people have died. So that's a mortality rate of just below 20%, and I'll come back to that. Luckily, also 19 people recovered from the virus. If you get identified early enough, then this happens. And 5,500 contacts have been identified in the DRC. We know the infected and affected areas, the Ituri province and North Kivu province and the South Kivu province in DRC. This is just a slide to show you that outbreaks of Ebola are not new at all in this area. Here you can see previous outbreaks of Ebola or Ebola-related viruses between 1976 and 2012 in the same area. So obviously the reservoir of those viruses, which are very likely bats which are residing in caves, is still around and is still spreading. The situation in Uganda, as of yesterday or the day before yesterday, is 19 confirmed cases. 14 of them have been imported. Likely all of them have been imported. 2 fatalities, 5 people recovered, and around 800 contacts at the moment. If we look at the female-male distribution in age groups, it is kind of 50-50. In DRC, we see that on the left part of this slide. And we see in Uganda, there is slightly more males infected than females. But it looks overall, it's a kind of 50-50 distribution. As I told you, Ebola is basically a group of viruses, four different groups of viruses combined, but they give the same clinical symptoms. So there is the original Ebola virus, there is the so-called Sudan virus, there is the Bundibugyo virus, and that's the one that we're talking about today, and there's a Thai forest virus. And the Bundibugyo virus is named after a small village, Bundibugyo, which is at the border between DRC and Uganda, as you can see on the right-hand part of the slide. And all 4 viruses give similar clinically symptoms. We can see here the different outbreaks of the different types of viruses in Africa. So there have been big outbreaks also in West Africa, as you know, in a couple of years back, 2016. Many outbreaks in the Congos and the border Congo-Uganda. And you can see here the Bundibugyo viruses only had 2 outbreaks before. These are the yellow spots that you can see over here and over here. So these were the 2 previous Bundibugyo outbreaks, and this is the 3rd Bundibugyo outbreak since 1976. Ebola viruses belong to the family of filoviruses. Philo because they're long, and the first one that was ever identified was in 1976 and named to the then Zaire, and named after the Ebola River. So that's where the name comes from. And it's basically a quite complex, long virus with lots of proteins and RNA in its genome. Let's not get into the details, but it gives you, it is a much bigger and more complex virus than HIV, for example, and also much bigger and complex than COVID. We know that infection occurs after exposure to sick or dead people with Ebola. And the incubation period can be from 2 days to 3 weeks. Yeah, usually between 1 or 2 weeks. And you feel well, you have no symptoms, and you cannot transmit the virus. Then, at a certain moment, you become contagious after 2 to 3 weeks in the dry phase, and symptoms appear like fever, fatigue, headache, joint pain, muscle pain, back pain, sore throat. All those symptoms are the same almost as any common cold or malaria or other infectious disease. So it is not very specific. Then later on in the disease, diarrhea and vomiting comes up, and of course bleeding starts, and hiccups and eye redness related to bleeding. And then of course the patient becomes very contagious, and in the end, when people are dying, then they are extremely contagious. And death, even after death, contagiousness still exists for many days. So person-to-person transmission definitely takes place through blood, through feces and vomit, urine, tears, saliva, breast milk, vaginal secretions, amniotic fluids, sweat, semen. but not through direct contact with between people. It's not spread like that. It needs fluids. What does it do? Basically, if we go to the biology, eventually it first infects your macrophages, which are in your blood, and then from your macrophages, the virus can jump into parenchymal cells, and these are the cells that make your organs, whether it is your liver or your spleen or your pancreas. And then, of course, the virus creates massive failure of your organs, which can create severe problems resulting in death. If we look at the fatality rate of the virus, at the moment, it is in the order of 14 to 20%. So we see the fatality rate at the bottom in the 2026 outbreak. If you compare it to previous outbreaks, this is relatively low, but of course that could also be underreporting. We still need to get better data on this. The viruses come from reservoirs which are usually bats, and the bats can infect other animals in the animal kingdom, like gorilla, chimpanzee, duiker, and certain bush animals, which then can infect human beings. Human beings can infect other human beings. Some of the people, of course, die, and other people survive and become carriers. And the most likely reservoir is for the Marburg virus, which is a family member of Ebola, is the bat. Do we have any tests for the viruses? I'm almost at the end of my presentation. Well, basically very few, and even commercial tests are still not yet in the official regulatory phase, and they are still in the research-only phase. We see that there are rapid tests for Ebola available, but they show low sensitivity. You can see that in the red areas, negatives instead of positives. So in fact, the only testing system that gives quite reliable results at the moment is the Gene Expert system. You know, Gene Expert is being used a lot for TB and also for HIV. But of course, the problem of Gene Expert is you need a machine, it is relatively expensive, and there are huge shortages of cartridges. So basically, diagnostics are really running behind. The last part of my presentation just would like to emphasize information is crucial about these diseases because if that doesn't happen, we get potentially issues like we have seen in DRC with burning of facilities and massive unrest amongst infected populations or people related to infected patients. The final one slide here is the latest security situation update, which is that the airport again in Ituri province has been closed on June 6th, 3 days ago, after being opened and closed again. The borders between the Ruzizi 1 and Ruzizi 2 borders between DRC and Uganda are closed, and only cargo trucks can pass. And there were indeed attacks of the Allied Democratic Forces in 3 villages, unfortunately in the North Kivu province. And in Kenya, protests have erupted because of a government plan to establish an Ebola quarantine and isolation center for American exposed citizens in Nairobi. So far, so good. That's my presentation. Over and back to you, Jennifer.
Thank you very much, Prof. And if you can see your React button, people can give him a round of applause. He gave us some really important insights into exactly what's happening currently around the recent new strain of Ebola that's ongoing in DRC and in Uganda, with likely possibilities of spread to other areas in the region. Of course, Nigeria being a country that has a lot of travel, I'm sure we know that we're, quite at risk. I was really excited to see some of his explanations on what it does look like and what the current status is around testing, which I feel is actually a big issue currently because the challenge is that it cannot be easily detected, yet it's a very deadly virus. So thank you very much, Prof. Please keep your questions for him. We will take a time of having a Q&A session. We're leaving some good for that. And so please keep your questions or throw them into the chat, and we'll surely get to them to answer any questions that he has. So thank you very much, Prof, once again, for gracing us with your presence. And do stay online, because definitely I'm sure you're going to have a lot of questions. Now, I'm actually honored to introduce the next speaker, who is a doyen in the profession. Is actually been extremely instrumental to addressing a number of pandemics in the country, especially in Lagos State. And so I'm going to have the singular pleasure of, before you put the mic on him, let me give his bio. So he's the Director General of the Nigeria Center for Disease Control and Prevention, Dr. Jide Idris. He leads Nigeria's National Public Health Agency, responsible for disease surveillance, preparedness, prevention, and outbreak response. And under his leadership, the NCDC continues to strengthen Nigeria's capacity to detect and respond to public health threats. In addition, for those who didn't know, he's a three-time Commissioner of Health of Lagos State. And we know that Lagos State is usually the state that has the first point of call when it comes to any disease, due to the large numbers of people who come into Lagos State by air, by road, by rail, by sea every day. And so he's actually going to take a presentation for us today. And so I'm really excited to have Dr. Jide Idris, the Director General of the Nigeria Center for Disease Control, to take his own presentation. Over to you, sir. Thank you.
Can you all hear me?
Yes, we
Yes,
can.
we
Can you hear?
So we can
Yes, sir.
see you.
Okay, you can see me. Yeah, I'm naked.
Hopefully not, sir.
Hopefully. Let me say, distinguished representatives of the Healthcare Federation of Nigeria, PharmAccess, Society for Family Health, healthcare leaders, facility managers, healthcare workers, development partners, and colleagues. I say good afternoon. I don't have a presentation, so I'm just reading because I didn't have enough time to read it well. I say good afternoon. First of all, Ebola preparedness is not a plan. It is a system that performs when tested. The first test may not happen at the national level. It may happen at a triage desk, a private clinic, a maternity home, or any point where a patient first seeks care. That is why healthcare facility readiness matters. For Nigeria, this readiness rests on three foundations: preparedness, surveillance, and response. Preparedness ensures that facilities, healthcare workers, supplies, and protocols are ready before a threat arrives. Surveillance ensures that risk is detected early and information moves quickly enough to trigger action. And response ensures that once the threat is detected, it is contained quickly, safely, and effectively. The strength of our health security depends on how well these three elements work together. Let me commend the Healthcare Foundation of Nigeria and PharmAccess and the other people for convening this timely discussion at the intersection of patient safety, quality of care, and health security. This is the context for today's discussion. Like Tobias said, the ongoing Ebola outbreak in the DRC and Uganda is a reminder that infectious disease threats remain a global reality, a regional reality. Current reports indicate ongoing transmission in affected areas, with public health authorities continuing surveillance, contact tracing, case management, and risk communication. While Nigeria has not recorded a confirmed case, increased regional travel and population movement underscore the need for sustained vigilance and preparedness. Preparedness cannot begin when the first case arrives. By then, the health sector is already being tested. The WHO estimates that Ebola outbreaks have recorded case fatality rates averaging about 50%, with some outbreaks reaching as high as 90%. For the current Ebola virus disease, there is currently no licensed vaccine or specific treatment. That makes early detection, infection prevention and control, healthcare worker protection, triage, safe isolation, referral of suspected cases, safe sample handling, timely reporting are first line of defense. Like I said before, Nigeria has no confirmed case of this outbreak at the time of this event. However, based on the dynamic risk action conducted by NCDC and partners, immediately after the fake declaration, the overall risk of importation of disease into Nigeria has been assessed as high due to increasing ongoing regional transmission, international travel, regional population movement, major airports, seaports, land borders, informal crossings, trade routes, and the overlap of early Ebola symptoms with common febrile illnesses, such as malaria, Lassa fever, and other endemic infections. The NCDC has activated its National Emergency Operations Center, and it is currently in the alert mode, coordinating national preparedness with relevant federal and state institutions. State governments have been requested to ensure immediate operational readiness across public and private health systems. Accordingly, our preparedness was focused on early detection, immediate isolation, optimized supportive care, strict infection prevention and control, safe sample handling, including laboratory testing, contact tracing readiness and safe referral systems, and risk communication and workforce protection, and of course, case management. Let me describe a bit what we've done, our strategy as a nation. Our initial strategy is not to allow this virus to come into this country. And that's why a lot of focus is being on at the port health services and our ports of entry. We recollect we had a meeting with many stakeholders, including the Chief of Staff, the Minister for Interior, aviation agencies like FAN, NCAA, immigration and customs officials, and including the Lagos State government. An entry protocol had been released by the Minister for Health, which all agencies of aviation are implementing. Basically, any airline, any airplanes coming from those targeted facility, areas down south like DRC, Congo, Uganda, Ethiopian Airlines, Kenyan Airlines, one or two others. Before patients board, they need to be screened. Each one of them must complete our health declaration form online, which we assess, so that as they come in and after the assessment, suspect cases are taken out, because the airports again are being upgraded with scanners, etc. Surveillance systems are there. All of them are working hand in hand with the Lagos State government, just in case you may need to transport a patient or a suspect case to an isolation center in Lagos. But beyond immediate outbreak risk, there is a wider lesson. Preparedness is not only an outbreak issue. It is first a quality issue. A facility that can safely identify and manage a suspected Ebola case is usually a facility with strong triage system, functional infection prevention and control, trained staff, clear reporting pathways, protected health workers, and a culture of safety. Preparedness is quality tested in real time. The same capacities that protect us during outbreaks are the same capacities that make us safer every day. This is why readiness must be demonstrated, not assumed. At NCDC, we're strengthening preparedness, surveillance and responsible surveillance systems, laboratory readiness, emergency coordination efforts, healthcare worker training, risk communication, and Ebola IPC readiness assessment for healthcare facilities and treatment centers. These assessments help identify operational gaps, guide corrective actions, and strengthen preparedness across triage, IPC, health worker protection, and all the things waste management, supplies, referral, and reporting pathways. The objective is clear. Identify weaknesses before an outbreak exposes them. Correct gaps before they become failures, and strengthen preparedness before it is needed. This is why SafeCare4Outbreaks is timely and welcome by PharmAccess. Building a SafeCare experience across healthcare facilities and the deployment of the SafeCare for COVID app during the COVID-19 pandemic, SafeCare4Outbreaks brings a quality improvement lens to outbreak preparedness. It provides facilities with a practical mechanism to assess vulnerabilities, prioritize action, and track improvement over time. The lesson from previous outbreaks, including COVID-19, is clear. Facility tools are most useful when they help teams identify gaps early, correct them quickly, and sustain safe services during a public health threat. Whether through NCDC readiness assessments or quality improvement tools such as SafeCare4Outbreaks, the principle remains the same. What gets assessed can be improved, and what gets improved is more likely to perform when tested. Assessment must therefore lead to action. Data must inform decisions, gaps must lead to correction, and correction must lead to measurable improvement. This is especially important for private and community-based providers. In many communities, the first suspected case may not present at a tertiary facility. It may present at a private clinic, maternity home, pharmacy, or another trusted point of care. Preparedness must therefore reach the whole health system because surveillance begins where patients first seek care. And response succeeds when every point of care understands its role. Let me conclude with 3 messages. First, preparedness must begin before the first case is confirmed. Second, surveillance must detect risk early enough for action. And third, response must move as soon as risk is detected. In general, when looking at case management, risk communication, laboratory preparedness, we've identified specific labs that have the capacity to detect Ebola. Treatment centers across the country, especially in those states that have international airports, 5 of them, Lagos, Abuja, Enugu, Port Harcourt, and Kano, first of all, our initial targets. All states must be in the state of readiness. They must have their treatment centers. They must train their staff. They must ensure IPC. These are all the things we are doing for now. Ebola will not be contained by plants alone. It will be contained by facilities that detect early, detect healthcare workers, isolate safely, and report without delay. All the tools exist. Everything is clear. What is required now is disciplined execution at every level of the health system. So thank you all for listening.
Wow. Thank you very much, Dr. Jide Idris. The voice you just heard now is the Director General of Nigeria Center for Disease Control. As you all are aware, the Center for Disease Control is responsible for pandemic preparedness, surveillance, prevention, and the outbreak response. And he has taken us through some really interesting areas in his speech. I'll take a few sound bites. For example, one that I took was that it's like preparedness is quality tested in real time, and that it's the importance of surveillance but also what gets assessed can be improved. I think that's something that's really important. Often as healthcare facility workers, we run away from assessments, but it's only if you assessed that you'll be able to improve any challenges. He ended up with 4 areas. I'll call them PSR. 1, preparedness must start immediately. He talked about the importance of surveillance to detect a case as soon as it arrives. And he talked about how response must move immediately to address any challenges that may be there. So once again, a very warm thank you to the DG of the Nigeria Center for Disease Control and Prevention, Jide Idris, and also, of course, a three-term Commissioner of Health of Lagos State, which was, of course, why I was assigned to this. It was instrumental to addressing the Ebola epidemic that happened in Nigeria sometime many years ago. Thank you very much, sir, for being here. And please stay on. There are obviously a lot of questions that are going to come up. I already saw a number in the Q&A and in the chat. I saw a request that some people would like the slides. That is noted. HFN will send you PDF copies of the slides from various presentations. So I see about 5, 6, 7 people requesting. Don't bother requesting anymore. I've already responded to that and we'll be able to send you the slides. Prof, I believe you'll be happy to share. And I believe Dr. Idris, I hope you'll also be happy to share your speech and also be available for questions. Excellent. So I'd like to take our last speaker of today. Remember, we're trying to leave some time for Q&A. Like I said, I've already seen a number of questions in the chat. But I think something that our health facility providers have probably been waiting for is what is this Safe Care for Outbreaks all about? And so I'm actually very pleased to have Dr. Rinke, who is the Director of Self-Care at PharmAccess Nigeria. She's going to be our next and our final speaker. She has actually been instrumental to advancing healthcare quality improvements and facility strengthening initiatives across Nigeria. I've known her for many years. Some of her game-changing work has been around expanding safe care to the private sector, to the public sector, and also including the pharma, primary healthcare sector. So we're really so excited to have you here. And she has helped many healthcare facilities improve their standards, patient safety, and operational readiness. And so I'm handing over the mic now to Dr. Dada. So please go ahead and speak to us about safe care for outbreaks. And now we can address healthcare facility readiness in Nigeria. So over to you, Ma.
Thank you very much, Dr. Ayonti. Good afternoon, everybody. I'm trying to share my slide. Can you all see my slide?
Yes, we can.
Thank you. Good afternoon, everybody. I will be talking about outbreak preparedness using SafeCare for Outbreaks. We're all aware of the Ebola outbreak currently happening. And I know that Prof. Tobias, Dr. Idris have clearly spoken about the challenges and how prepared we are as a nation to combat if we do have an Ebola case in Nigeria. For us in SafeCare, our greatest concern is how to ensure that facilities are actually prepared for maybe the very first case of Ebola. And one of the things we've realized is that you need to be prepared for outbreaks because of the systemic challenges that occur from outbreaks. The challenge to the health system itself, because I know with COVID, we're able to see that both the weak and the good health systems were challenged by the pandemic. We're still recovering till date from the economic effects of COVID. And then we also realize that with outbreaks, you're having issues around global health security and national health security. So we've had Since COVID in 2020, we've been able to learn a lot of things around how to prepare facilities for outbreaks, ensuring that facilities are ready in terms of their processes, their structures, in terms of the supplies that are available within the facility. For SafeCare for COVID, we developed it in 2020. It was a rapid response to the pandemic at the time, and it was implemented by over 1,000 facilities across 19 countries. And we've actually shared the results in various journals, including the WHO. And we were able to develop, facilities were able to download the tool, self-assess, look at their processes, look at the availability of equipment, commodities, and be able to generally see how prepared they are to reacting to a case of COVID, but in this case, a case of Ebola or Lassa fever or any of the other epidemics or outbreaks that we may have out here in Nigeria. So one of the things that we were able to show was we had a dashboard whereby facilities could see how well they performed in terms of their assessments. So they were able to see the availability of their commodities and the overall preparedness of their facility. And it's based on these insights that we've also been able to develop SafeCare4Outbreaks. But in developing SafeCare4Outbreaks, we first and foremost were ISCO accredited, so we relied on our learnings as being an ISCO accredited organized, having ISCO accredited standards. And we also used literature, WHO's guideline on infection prevention and control for Ebola and Marburg disease. And we also had a group of experts review the tool. So the current tool that we have now has 50 questions, and those 50 questions are broken down into two sections. First section looks at processes, which are about 30 questions, and then the second section looks at supplies. And so this is kind of like a screenshot of what the tool looks like, and this is what the facilities will use to self-assess. 50 simple questions, a free tool that is available for facilities to download, 50 simple questions. It can be answered within 30 minutes. You get assigned a quality score, first a preparedness score, which tells you whether your processes are in place, and then you also get a supply score, which is what you're seeing on the right side. But it's not only the facilities that require information or insights. We also have what we call the quality platform, which networks decision makers like government, NGOs, FBOs, and provider networks or aggregators like even the Healthcare Federation of Nigeria can use. First and foremost, you're able to gain semi-real-time data on the status of facilities within your network. You're able to use those actionable insights to allocate resources that would actually help facilities to improve. And then you're easily able to communicate across your network. We also expect that you're not just looking at the insights, we're expecting you to use the insights to improve the services that you provide. So this is just, this shows the 30 process questions. They're actually aggregated across 6 different sections. The first section looks at outbreak preparedness and response. And so that's where we talk about contact tracing, health intelligence, and surge capacity with triage. Then the second section looks at human resources and workforce. So we're looking at workforce capacity. We are even also looking at the mental health of those who work within the hospitals. Then we also have infection prevention and control, looking at access control, cleaning and disinfection. We also look at patient care and clinical management. So whether everybody is aware of the treatment guidelines, case management, critical care management, patient and specimen referral, and how to manage the health records of your patients. And then we're also looking at infrastructure. Infrastructure is key: your electricity, water supply, isolation unit availability and maintenance. Even the toilet and washroom facilities are part of what we expect you to self-assess. And then lastly, equipment and consumables. We're looking at your equipment maintenance program, your laboratory specimen collection, and vital signs monitoring equipment, the availability and the condition of these equipment. On the supply side, we have 20 questions, like I mentioned before. We're looking at the availability of clinical equipment, diagnostic supplies, and patient care materials. We're also looking at the availability of personal protective equipment. I know we would all recall that during COVID, we had a global supply chain crisis whereby many facilities were unable to access personal protective equipment. And then we're also looking at your infection prevention and control supplies. So how do you register? If you're interested in doing a self-assessment using the SafeCare4Outbreaks tool, we would send you a flyer. So you also have access to a flyer. And on that flyer, you can actually scan the QR code on the flyer. You could also copy the Microsoft form link on the flyer. So the Healthcare Federation of Nigeria will have this flyer to be able to circulate to its members, as well as the link. The expectation is that you would complete the form, indicate your name, your mobile, your email, the name of your facility, and full address. Full address meaning the street name, the local government, if it's not Nigeria, district, or province. And once you've done that, once we receive that form, you would receive a link inviting you by email to access SafeCare4Outbreaks. And so that's the last picture on the right. And when you receive that invite, you would also have some informational materials attached to it, giving you information on why you need to be prepared, why you need to ensure that your facility improves in quality, and then you would have access to the tool to actually do your own assessment. So this is a view of the tool. The first screenshot shows you the onboarding. The second screenshot shows you the self-assessment itself, welcome, and all up till the time you get your score. And the nice thing about it is once you get your score, you're also going to be directed to where you can access your quality improvement plan. And the expectation is you would implement the task of your quality improvement plan and upload evidence of the task that you have completed, either by providing a guideline or providing your SOP or a picture that shows that something has been done. So we expect some form of evidence that you have completed a quality improvement task. And the nice thing about SafeCare4Outbreaks is that you can do your first assessment and decide that in another 2 months or 3 months, I want to reassess based on the activities that I've implemented or tasks I've implemented in my quality improvement plan. And thank you very much. I actually have a video, a demo video, just 2 minutes, 30 seconds, that would show you how SafeCare4Outbreaks actually works. Thank you very much.
I hope we still have Jennifer.
Please share the video.
Benjamin, are you there? Can you share the?
Yes, I'm back.
Okay.
Yes, I'm so sorry.
All
My
right.
apologies, Dr. Dada. I was just saying thank you to you. I think maybe the Zoom didn't want me to say that big thank you, but a very warm thank you to you for that presentation. While we are setting up for the questions, I hear you have a video. Is it a minute? We can
Yes.
quickly have it. Yes, great. So let's quickly run the video while I begin to organize for the questions. Thank you very much.
You might need to enable the audio.
Okay. Tech, please, can you enable audio? Thank you.
Okay.
Now it's
Yeah, if there's no
15.
audio, just go ahead
Yes.
and play the video because it just runs you through the different screens so that we don't delay.
You can leave out the audio, please. It's fine.
Sorry, Njide, can you hear me?
Yes, I can.
Well, I'm sorry, I have to go. I'm supposed to be somewhere in another 2 minutes. They just called now.
Oh, wow.
If you don't mind. Yeah.
Wow.
All
And
right.
we had
So,
there were a fair number of questions for you, but
we'll
Can
pass
I
it on to you.
can I
yes,
text my answers because they're just waiting
yes,
now?
sir.
Because
I wouldn't mind that, sir.
I will text the
If you
answers
look
to you.
okay, sir. And then I'll put
Yeah.
them in the chat. So apologies for all those who had questions for Prof.
So
I
my
mean for Dr.
apologies
Idris.
because I've been summoned.
Okay, sir. And you've received some greetings from persons that know you. I saw a member of the NEC of National Executive Council of HFN, Dr. Aribabu, who was sending his greetings to you, sir. So please do note.
So my apologies to all. I will respond to those questions and get back to you.
Excellent,
Okay,
sir.
thank you
Thank you very
very
much.
much.
Thank you, sir. Once again, a very warm thank you on behalf of the health sector in Nigeria for all you do. Thank you very much, sir. Okay, so maybe we'll just while this video is scrolling, maybe we'll take a few quick questions. I'd like to say number one, a warm thank you to Margaret Ayorinde and other health workers for your service as part of the response to Ebola many years ago. So thank you very much. Just to call you out, I noticed that you commented in the chat, so thank you once again. The first question was for Dr. Idris. He talked about the importance of developing border protocols for entering airports, but what about other points of entries? Do we have protocols for these entries? He will answer that question online, but I would like Prof to also mention what maybe is being done in other countries to address border protocols for entering through other points of entry apart from through the air. There was also a question.
I got that, but
Okay.
no problem. We've already done it. We have done it. It's just music is playing. It's not saying anything.
Okay, thank you,
So I'm
Benjamin,
going
for
to
that.
stop.
No problem,
Benjamin, please
Benjamin.
mute
Thank you.
yourself. Yeah.
Please do mute. Okay, so there was also a question whether a message was sent to Nigeria CDC 2 days ago about someone who came in from Congo, and as the person being contacted for contact tracing. I believe that has been addressed recently, and the person was contacted, but I'm sure he will answer that question in the chat. Then there was an attendee who said, is there any way to curtail Ebola from entering the country from the borders? I think that question has also been responded to, and Dr. Idris will also respond in the chat. Then again, another question for the Nigeria Center for Disease Control. It was asking about nationwide dissemination of social and behavioral change communication on Ebola prevention. He did mention that quite extensively in his speech. In epidemic and pandemic preparedness is called risk communication and community engagement. I'd like to say also this webinar, for example, and other webinars that are being set up around the country about Ebola is included. But for nationwide, he may wish to also respond to that. but I believe a number of partners have started getting involved in this, including, for example, PharmAccess, Society for Family Health, among others. Questions for slides. Again, question for Dr. Idris. Preparedness in tertiary institutions, especially places where lecturers are actively traveling and students are also going out. So the medical centers are not well equipped. And I remember he did answer that. I did hear that funding has been released to address preparedness for Ebola already to NCDC. Madam President of HFN, I know you had a comment there, so I'd like you to respond to this particular comment on where preparedness and funding, because I know you said some funding has been released. Would you like to share about that?
So sorry, before you you continue, I thought Professor Tobias I think he had some comments
Yes,
to make.
I will still go back to him very soon. He
Okay,
had
and
answered
there were
some,
some
yes,
hands raised.
yes, and then we will take some hands. Yeah.
Okay, so the comment around the funding is fresh news. I think it was on the news yesterday that His Excellency, the President of Nigeria, has released 10 billion towards Ebola preparedness. And I think Dr. Idris talked about the focus areas, which is the entry ports. So, like I said, it's still fresh news. We don't know how that funding would be distributed. But at the same time, I know there's also ongoing discussions amongst private sector organizations, the same way they rallied around during COVID to put together a fund for Ebola. That discussion is also ongoing. So this is, real-time movement. So I think in the next few weeks, we will know exactly what the plans are, who will be involved. But as Healthcare Federation, of course, we are trying to contribute our own quota by, first of all, organizing this webinar and also letting them know that private sector is providing quite a lot of the care in Nigeria and will probably be the first point of contact for those who haven't been detected at the port. So it's important that we are part of that funding distribution to strengthen our healthcare system, as well as training and capacity building to be able to handle any detected cases. Over, back to you, Jennifer.
Thank you very much, Madam President, for that and highlighting the importance of the private sector in this. Now over to Professor Tobias. You had a lot of questions. Thank you for answering a few in the chat. I think maybe you could take a few questions around prevention, treatment, and vaccines. What's the current status, and how can Nigeria get involved in addressing prevention? Over.
Thank you very much. Concerning treatment, at the moment, there is no real treatment available. The first clinical trial with remdesivir is just starting. Remdesivir is one of the antiviral reagents, but it's too early to say anything about it at this stage. Vaccines are also not available for this one. So it is all a matter of maintaining your patient early recognition, early detection, and early taking care of any patient case. In terms of prevention, obviously, since we know the transmission is going through fluids, anything related to contact with fluids of infected people is, of course, dangerous. It is a very infectious virus, particularly in the last phase of life and after death even. What I wanted to say about borders, there are currently ways to do wastewater sequencing of airports or of airplanes even. It is possible nowadays to do quite straightforward sequencing on the wastewater of, for example, at-risk flights, which are coming in from countries at risk. That has all kinds of political consequences. Airline companies don't like it. It can create tensions, but on the other hand, it is a very powerful tool and very affordable nowadays to apply. So wastewater sequencing for airborne transmissions through airplanes is possibly something to keep in mind. Also, with respect to the private sector, I think the private sector taking care of more than 50% of all patient encounters in Nigeria is undervalued as a contributor to the epidemic preparedness system in the country. And with PharmAccess, we are dedicated to try to push for this in different ways. And with private sector, I mean not only the formal sector healthcare providers, which are high level and connected to Healthcare Federation Nigeria, but particularly also the ones linked to the Pharmacy Council in Nigeria, the CPs, the community pharmacies, and the PPMVs. And even though they might not have the means to identify clinical symptoms in detail, there are, of course, tools like the IDSR Lite tools that can use a symptomatic approach to at least identify potential patients at risk. Over to you.
Thank you very much. Thank you very much, Prof. I think those were very useful. That's very useful information because there are no private sector providers here. You've shown them, of course, SafeCare. Dr. Dada showed them SafeCare for Outbreaks. That's one tool they can use. You've also mentioned IDSR Lite, which will be useful for community pharmacists, billion and proprietary medicine vendors to be able to even report suspected cases. And for those on the call, often the first point of call, people come, I'm feeling sick, I have flu, you do a malaria test, it's negative. You should have an index of suspicion, ask questions. Did you recently travel? Have you been exposed to somebody who has traveled? Don't just assume it's something else or start the person on supplements. So that epidemic awareness is what we're trying to build in organizations such as HFN and others, so that people don't miss symptoms as a result of this lack of awareness. I guess another question that people did raise up, and this again is for you, Dr. Dada. Can you just get the SafeCare4Outbreaks app on the Google Play Store or the iStore, the iPhone Store, and download it from there? Is it free? What else do people need to do to get to use it? So over to you for that.
Thank you very much. The SafeCare4Outbreaks is actually free, but the only thing is you can't download it from Google Store. But we've actually put a link in the in the chat box to show how you can access it. So once you click on the link, you would fill in your details and then we'll send you a unique link that your facility can use to self-assess. One of the things we want to avoid is to ensure that facilities don't register multiple times with different people, and then the database becomes one facility could have 5 different persons trying to access the app, and that may be a problem when it comes to data quality. So our preference is to have a unique ID for each facility that uses the SafeCare4Outbreaks tool. So I'll share the link once again, and I'm sure if you visit our website, you would also be able to access the link.
Thank you very much, Dr. Dada. Let me see. I think there are some. Let me see if there are any hands up. I
There are
can't
2
see
hands up, Dr.
Okay.
Aribabowo and
Yes, I can see.
Boyka.
Yes, thank you. I couldn't see the attendees list initially. So of course, I have to give the mic to my senior colleague. So first of all, Dr. Aribabowo, then we'll take Boyka Queen and then Adebayo Sama. Please let's try and keep it to a minute so that we'll have time to answer the questions. Over to you, sir. Dr. Aribabowo. Can you unmute? Who is Tech, please? Can you unmute? Tech team, can you please unmute? Yes. Please unmute Dr. Aribabowo. Thank you. It's still muted.
I was trying to unmute. Can you hear me, please?
Yes, we can hear you now, sir. We can hear you now.
Thank you very much. I'm grateful I'm part of this session. And going by experience, the Association of General Private Medical Practitioners of Nigeria is now known as Association of Nigeria Private Medical Practitioners. We are trying to disseminate awareness on this news as fast as possible, because they say once bitten, twice shy. And I can assure you from the platform of the Healthcare Providers Association of Nigeria, which is NIPAN, AMPMP, even to the level of NMA, we are trying to buckle our belt and getting ready and getting set for the likelihood, we don't pray, having anything like an entry point in Nigeria. We are disseminating, we are learning from experience, we are taking cue from our past experience. So please, we want to collaborate, we want to work together. We'll be liaising with HFN, liaise with
Did we lose him?
I don't know if it's my network. I lost Dr.
Yes, we
Igbabu.
lost him. Oh, okay.
Yes, we lost him. Okay. So maybe while he's in case he comes back, could we please take Boyka Queen? Boyka Queen, with your question, please unmute as soon as you are given a mic. Boyka Queen, please unmute. You have been given a mic. Yes. You've muted yourself back again. Please unmute again. Okay, we take Adebayo Samuel then. Adebayo Samuel, please go ahead.
Good afternoon.
Good afternoon, sir.
Everyone in the house. Okay, thanks so much for this program. I think it's the best time to have such a gathering, because I get worried a few days ago, I think about 2 days ago, when a young doctor called me from the island that he saw a patient, one HMO patient, and though the patient didn't come with fever, but he gave them a history that he just came back from this DRC 3 days ago to Nigeria. And when he was there, he was admitted in a hospital and was treated. But as at the time he came to Nigeria now, he does not have fever. But immediately the young doctor called the CDC, gave all the phone number, every contact of the patient to the CDC so that they can do a contact tracing. So I don't know if anything has been done about that. But I think we need to be very careful, because our border is, I'm sorry to say, our border is not as fantastic as we think it should be. I remember the COVID. I was out of the country when the first COVID case was first diagnosed in Nigeria. I just myself and one other gynecologist, we just saw it we were on the training for a gynecological subspecialties then. Do you know that when we came to the airport, they just gave us a paper to fill and we're just left like that, So for days I was expecting that somebody will have, at least they will have followed us up and all that, because as at that time, there was COVID in Dubai, where we were coming from. So even we ourselves were worried. We had to some of us had to even isolate ourselves. But nobody even contacted us. We dropped all details. That means that could have happened to anybody. Just like what the last episode of Ebola, that the guy just came freely and was first detected in a hospital. And he didn't walk in. He came by air. So I think we need to do something. We need government to do something about this, our border, because it's becoming very, very risky. Thank you very much.
Thank you, sir. Thank you very much, sir. And of course, you didn't put Dr. Adebayo Samuel for that for what you've discussed with us. Obviously, you are. I think maybe Dr. Tobias, Professor Tobias would like to maybe respond to the question on what else is being done, maybe like in other countries, around securing borders that are not air borders. Often the challenge is that we secure the airports and all that, but people are coming in by sea, by road. And so what else is being done around that in other countries that Nigeria could take examples from? But before you take that, Prof, I'd
And
just
we
like
should
to
not,
find out if
sorry, I
Boyka
forgot. We
Queen
shouldn't forget
is
that some
now
also come in
online.
through Egypt.
Oh yeah, of course. Actually, that is a lot of it. I'm sure you're talking about through like Borno State, through the
Yes,
the
who come
desert.
into
Yes.
Egypt, who come
So
by
again,
road.
another
They come by road through
yes.
Egypt and enter the country.
So non-air travel. How are we securing those borders? Thank you. Worker Queen, last opportunity. Are you still there to take a question, to speak your question? If not, I go over to Prof to respond to what other countries could be doing that Nigeria could learn from to secure borders that are not air borders. Over.
Thank you. Yeah, borders are never completely safe, nowhere in the world, and certainly not in the African context where borders are often artificial and in difficult areas to convey. So I would say the most important border is basically the clean and eager eye of the doctor, of the PPMV, of the pharmacist, of for people who have symptoms that could point towards this. So therefore, I think that the SafeCare for Outbreak tool is a very good tool to help because it increases awareness. We should all keep our eyes and ears open as much as we can. I think it is literally impossible to close borders for any country. We have seen it with COVID. We can try to limit, but we can never close. So I think the best way of dealing with this, as with any epidemic, is keep eyes and ears open and be informed. Be informed. Spread the word. That's what I would say. Thank you.
Thank you very much, Prof. I guess maybe last question for you is from Nwabo Jane. And she said, confirmed cases were 550, suspected were 117. And that does that imply that the additional 433 confirmed cases, which were initially unsuspecting and possibly asymptomatic? So how can transmission be explained if infected individuals are asymptomatic? And then what research evidence supports transmission in asymptomatic cases?
Yeah, indeed, transmission takes place when people are symptomatic. But of course, like in biology, nothing is 100%. And so it can be that people who are pre-symptomatic or have light symptoms already become infectious. It is not a black and white situation as always. There is a gray area. As a rule of thumb, you can say people without any symptoms are very, very unlikely to be transmitters, but it is not completely impossible. I'm sorry, it's biology.
Thank you very much, Prof. The last two questions. One question on what phone numbers can we contact for suspected cases of Ebola? I'd like Madam President to answer this question.
In fact, I was trying to put the number. It should be NCDC number. So we're going to drop it in the chat. We're just trying to confirm the exact number because I see they have a toll-free number, but I want to ensure that it works. But the first point of contact should be NCDC or the state, like Lagos, they have an agency that
emergency
can also,
center.
yes. Yeah, so we'll pass on those
So
details.
each state has its operations center, and we'll put a link in the chat for everyone who needs to know. So again, like Prof said, the important thing is the index of suspicion. And then, of course, as a healthcare worker, please ask questions. Don't just assume. Ask questions. Use the tools that you are being provided with today to be able to assess your facility, and please ask questions. I think the last question I'll take is for Dr. Dada. There was a question about how does a facility stay prepared I know you've answered that a little bit, but I just wanted you to reiterate once again, how does a facility remain prepared for Ebola or the possibilities of Ebola coming in?
So I would like to say that we shouldn't see it as a facility being prepared for just Ebola. Right now in Nigeria, we still also have monkeypox. We still also have Lassa fever. So preparedness for any disease outbreak should be the primary concern of any healthcare provider. And that means you must have systems, processes, and the right equipment and supplies. So you need to have a strong triage system, and you need to have a way you can fast track and isolate those persons who are potentially infectious. So it means as a facility, you need to look inward and look at your workflow, your patient journey, right from when the patient comes into the facility all up till the time that you make a diagnosis or you come up with your differentials.
Yes, I think I really liked that perspective. And I think it's something also that Dr. Idris said. If you strengthen your facility, anything that comes in, you will get. I mean, you'll be able to address it. And so strengthening your health facility in general, using various tools, your health system, your emergency preparedness, your ability to address health challenges as a facility will actually prepare you for any epidemic. But like we said, suspicion, have an index of suspicion. Of course, don't start looking at every patient like you could possibly have Ebola, but at least have that index of suspicion, use the tools you have been provided with, call for help when you need it, refer as necessary. I think those are important things for every healthcare facility worker to realize. And so I'd like to make my last
Sorry,
1 minute or
Jennifer,
two.
there's one last question, which I think is very important, which is, it says, what is the definite lab test for Ebola? How do you confirm that it's Ebola? You know, I know the last outbreak, we had to send samples to Dakar. So is there any, Tobias, is there any test that can be done? How do we confirm that it's Ebola?
The best test at this moment is a gene expert test. And of course, if you have access to a real central laboratory, it is a PCR. But that is, of course, extremely unlikely, particularly in remote areas.
And I think we do have the gene expert machines in country, quite a lot of them. We use them for
the gene experts are
the
most point of care.
But maybe the cartridges may be the challenge here. So having those again, but I'm like has been mentioned before, there's been funding has been released to NCDC. So I'm sure some of this, there'll be some ramping up of, detection, case response, preparedness by various states around this Ebola issue. So I'd like to say a very warm thank you once again to our panelists, to Professor Tobias, who stayed all through, answered also questions. Thank you very much. Of course, Dr. Rinke Dada, presenting the SafeCare tool, advising us on health system improvements to be able to detect epidemics and pandemics early. Of course, we also had remarks from the registrar of the Pharmacist Council of Nigeria through pharmacist Njide, who told us about the importance of preparedness for pharmaceutical providers of care, such as community pharmacies and PPMVs. And last but not the least, a really warm thank you to the Director General of the Nigeria Center for Disease Control, who actually is the who is the one who is in charge of preparedness for epidemics in Nigeria. And he will definitely send across some responses. I'd like to also let you know that I'm handing over at this time to Dr. Benson Ndili Cole, and he may tell you a little bit about the Healthcare Federation of Nigeria. So once again, thank you very much, everyone, and over to you, Dr. Benson.
Thank you, Dr. Jennifer. And now, good evening, everyone on the call. Thank you for joining this very informative webinar, one that was actually very important for us to have. Thank you, Madam President, for also pulling this through in a very short time. Healthcare Federation of Nigeria, for those who may be encountering us for the first time, is the umbrella advocacy body for private healthcare sector in Nigeria. This organization has membership of various other organizations and associations in healthcare, in private healthcare in Nigeria. We speak with one voice, and that is why we have, a very strong reach. Our president, you have heard from already, is Madam Njide, who is also the country director of PharmAccess Nigeria. The event we have had today is very informative, as you can see. Also one that has significantly enlightened us as stakeholders in the industry for Ebola preparedness. But besides that, even general pandemic preparedness. Without repeating what every person has said, I think it's important for us to not undermine the place of health worker protection in all of this. Because as we talk about caring for the patient in a safe environment, we should also remember that the health worker that is caring for these suspected cases is also, are also at risk themselves, in the process of care. So we need to pay attention as healthcare workers to protect ourselves. And this is why going through the safe care pathway is very essential, because the training is not just for you to protect the patient or protect, other people in the hospital, but also to protect yourself as a healthcare worker. This disease, as you heard, is not vaccine preventable at the moment. There is no treatment. The treatment is purely on a case-by-case basis, based on individual need per time that is addressed. Also, diagnosis is very tricky. No, gold standard for diagnosing Ebola at the moment, as you heard from the experts. So it's a very tricky situation, and therefore that, high index of suspicion remains the only thing that is available to us at this moment. So we will be happy to continue to engage on this subject matter until that the current situation in East Africa abates. We need to be prepared as a country, and we're happy that the federal government of Nigeria has taken the bold step to release some funds towards this emergency preparedness. I hope that is something that will last for a while, not just being ready at this time and fall off afterwards. We will advocate on behalf of private sector as Healthcare Federation of Nigeria to see the role we'll play in the areas of community engagement, in the areas of training of our stakeholders, in the areas of information dissemination, in the areas of getting safe care involved, even in the private healthcare sector preparedness itself. We'll find a way to engage with government further to tap into the available resources where possible. So thank you so much for joining the webinar today, and thank you to all our eminent speakers who took time to give us information on this disease and the current the current realities as far as different countries are concerned. I like what Professor Tobias talked about, sequencing of wastewater from airlines, because this is what Rwanda as a country, even before this incident of Ebola, has been doing routinely. So I think it's important that Nigeria should look at that as well. We have a lot of East African airlines coming into Nigeria. We should be able to, screen their waste water and waste products from such flights, just to protect our citizens if we can. So once again, thank you. And as we close the meeting, continue to engage with us on the platform. And if you are not a member of HFN, it's important for you to aspire to become a member, either as an individual or as a corporate organization. There are lots of benefits will accrue to you, as you can see from what we do already. Even from this webinar, you can see that we bring critical conversations to the table and we dimension them appropriately. If also you want to enroll into the SafeCare pathway, for your hospital to actually go through the entire pathway of SafeCare training and accreditation, that this is also available. You can contact us at HFN. We will be able to link you up with the SafeCare operatives so that your facility can enroll to become a SafeCare facility, step 1 all the way to step 5. So thank you once again and have a pleasant evening, everyone. Thank you and bye-bye.
Thank you. Bye-bye.
Goodbye, everyone. Thank you very much for joining us.